All right, so today we are going to be talking about the foot. So here are the bones of the foot. Let's review some of the anatomical names of some of these structures. So the first thing we have is the top of the foot, right? Who remembers what the top of the foot is called? Remember our anatomical or regional terminology. This was the dorsal surface of the foot, right? Yes, this is the dorsal surface. So what is this surface then, the bottom? Yes, that is the plantar surface. Good. So we have the dorsal surface and the plantar surface. So I'm going to refrain from saying the top of the foot and the bottom of the foot. We're just going to refer to dorsal and plantar. It makes things a lot easier, especially when we go like this or we turn it upside down, and then what's the top, what's the bottom, right? It's all relative. So dorsal and plantar don't change whether the foot is like this or like this. Okay, so we're talking about the bones of the foot today, and also some of the arches of the foot. The arches are on page 385 in your book. I'm not going to screen share this. I'm just going to talk about them for a minute. You actually have 3 arches in your foot, and they make a bit of a triangle in order to stabilize the entire body, especially on uneven surfaces. Our feet are really good at doing this kind of movement, where it's a little bit of inversion and eversion, plantar flexion and dorsiflexion all at the same time. And the stability comes from those 3 arches. So what we have here, this is the midline of the foot. Okay, so this is your big toe here, your great toe. That's what they call it in the book. Scottish accent optional. This is the great toe. So this is the midline. This is your medial longitudinal arch right here. This is the arch that you think of as being the arch of your foot. You know, whenever you need arch support, it's the medial longitudinal arch that you're talking about. You also have a smaller arch on the pinky toe side. This one is the lateral longitudinal arch. So you have medial longitudinal arch and you have lateral longitudinal arch. But you have one more, and it's a little harder to see. It's right through the center here. Okay, it goes like this. If I put my finger in there, you can see that it actually is shaped like an arch. This is the transverse arch. And together, like I said, they make a bit of a triangle. So they come together at the ball of the foot, which is going to be right about here. And then you have the lateral longitudinal arch, the medial longitudinal arch, and then the transverse arch here. So kind of goes like that. In that little triangular shape. There is like I said, a picture on page 285 or 385, excuse me. So you can see it a little bit better there. Let's talk about what bones are in the foot and some of the other structures here as well. This is page 354 in your book. And what we have is a plantar view of the right foot. So we're looking at somebody's foot if they're laying supine on the table, okay? We're seated at the end of the table. Their feet are kind of in our face like that. This is a plantar view, okay? So the toes are called phalanges, and they start here. This is 1 through 5. Okay, toes 1 through 5. And this is called the great toe. It is referred to as the great toe in your book. And like I said, Scottish accent optional, although it makes it easier to remember for some reason. Okay, so we have the phalanges at the end, and then we have your metatarsals. Metatarsals. The metatarsals are anterior to the tarsal bones. Okay, so all of these over here are the tarsals. These are the metatarsals, 1, 2, 3, 4, and 5. Okay. On the distal end of the first metatarsal, you have 2 cute little sesamoid bones. they are actually embedded in tendons that move the great toe, okay? I'll show you those later, but remember all sesamoid bones are embedded in tendons, but you have two little ones right here. Okay, the rest of these, like I said, are tarsals, and they're actually named for their shapes for the most part. So we have the cuboid here, it's cube-shaped. We have the calcaneus, that's the heel bone. That's this very large one here. You can see it's a couple inches by a couple inches by about 1.5 inches high. It is a considerable bone. It is huge. That's the calcaneus. Superior to the calcaneus is the talus. It's this one right here. It's got a very smooth articular surface. Remember, the tibia and fibula articulate here at the talocrural joint. So this one right here is the talus then. We also have the cuneiforms. Those are these three right across here. 1, 2, 3. Actually, it goes 1, 2, 3. Okay. Those are the cuneiforms, the medial, middle, and lateral cuneiform. So those are all the tarsals. If we pull them apart, they're easier to see. So we have the cuboid. Again, it's supposed to be cube-shaped. We have the lateral cuneiform, the middle cuneiform, because it's in the middle, and then the medial cuneiform. And they don't change position, it's just the foot that you're looking at. So again, this is a right foot as you're looking at it. This is also a right foot, but this is the dorsal view. So again, here's the medial cuneiform, or I'm sorry, medial cuneiform, yes, sorry, middle cuneiform, medial and middle, really. And then lateral cuneiform, just because it's more lateral. And then cuboid is on the side here. There was one bone, however, that you could not see on the last image, and that is the navicular. It doesn't show up real well. It's kind of partially hidden by the cuneiforms. The navicular is actually supposed to be shaped like a sail. And you can remember that because of navigate, navy, ships using sails, that sort of thing. That's how I remember it. Okay, so here's the talus again, and then the calcaneus, and these are just articular surfaces, all the flat pieces that you see here. All right, so this is the view that I showed you here. This is a lateral view, okay, because you can see the 5th metatarsal. In other words, you can't see the big toe, you can see the pinky toe. And you can see this thing right here. That is the tuberosity of the 5th metatarsal. That piece right there. That serves as a muscle attachment site, and it is incredibly palpable. It is the bump on the side of your foot. It's about halfway between the toe and the heel. And you can absolutely feel it. It sticks out on everyone. That's the tuberosity of the 5th metatarsal, okay? You can palpate that right now if you are in your stocking feet or if you are not wearing any shoes, okay? The tuberosity of the 5th metatarsal is a landmark that we do need to know, of course. And let me clear that out for a second. Clear all drawings. There we go, okay. We also have joints in between our toes and our tarsals and our metatarsals. So in between the 1st and 2nd bones of the toes, these phalanges, we have interphalangeal joints, right? They're in between, so it's interphalangeal, so in between the phalanges. Between the phalanges and the metatarsals are the metatarsophalangeal joints. So You know the drill. Drop the last letter, add an O, smash it together. Metatarsophalangeal is the word, okay, between the metatarsals and the phalanges. Now, between the metatarsals and the tarsals, you have the tarsometatarsal joint. And yes, you do need to know these. It's a mouthful, absolutely. But it makes sense, right? You're just naming the two bones, dropping the last letter, adding an O, smashing them together. Okay. That's it. If we take a look at the medial view of the foot, it looks very different, right? We don't have that huge tuberosity there. We have phalanges, only 2 in the great toe, 1, 2. We have the metatarsal, and this is the base of the first metatarsal, just to give you an idea, because some bones are flipped where their base is up near, like more proximal, and it gets a little confusing. In this case, the base of the metatarsal is closest to the tarsals. Okay. We are going to have some bony, some muscular attachment on the base of the first metatarsal. Okay, so that's a landmark you do need to know. Again, taking a look at this view, you have the medial cuneiform. You have the navicular, which has a little tubercle right there called the navicular tubercle. Imagine that. You have the talus right here. You actually have a head on the talus and sort of like a tail. But I don't really care about that. What I am interested in here is the trochlea of the talus. The trochlea is this curved piece that articulates with the tibia and fibula. Okay, that's the articular surface, but it's called a trochlea. All right, then we go back to the calcaneus, right? This big honking bone right here. It has a tuberosity. Tuberosity of the calcaneus. It's pretty significant, you can see. Tuberosity of the calcaneus. It's big, it's even making a shadow because the light is in front of me, okay? Tuberosity of the calcaneus. All right, so I haven't had you do any of these in class yet, but in your book, they have trails. And remember, this is a trail guide to the body. So basically what you do is you follow along these trails. So these are palpation trails. So trail 1, lateral and medial malleoli, that's plural for malleolus. So you palpate those first, okay? Then you palpate the malleolar grooves if you can. Then you go to the calcaneus. Then you feel for the tuberosity of the calcaneus, and so on. So if you are palpating at home, which you should be, follow along with these trails. You won't be able to palpate everything all the time because obviously everyone's put together a little bit differently. Some of us have super bony hands and feet where you can feel just about every little thing. Some of us do not, and that's fine. Okay, but there are several trails to follow along with. All right. Okay, so you do have to know all of the bones of the foot and the bony landmarks. So tuberosity of the 5th metatarsal, base of the 1st metatarsal, you got to know medial, middle, lateral cuneiform, tuberosity of the calcaneus, trochlea of the talus, those kinds of things. And of course, the little sesamoid bones here. You also need to know the names of the joints in between each, interphalangeal joints, metatarsophalangeal joints, okay, so on and so forth. All right, when we come back, we will be talking about muscles. Woohoo!